Pharmacy Joe. Thank you for listening to the Elective Rotation, a critical care pharmacy podcast. This is episode 379. In this episode, I'll discuss an alternative scoring system for predicting the risk of augmented renal clearance. I have all the evidence supporting today's show linked up in the show notes at pharmacyjoe.com/episode 379. Augmented renal clearance is a phenomena in some critically ill patients whereby their kidney function becomes supernormal. Standard antibiotic doses are often inadequate in the setting of augmented renal clearance. This is also referred to as ARC. The most accurate scoring system to identify patients at risk for ARC is the ARC score. This score has a positive predictive value of 75% and a negative predictive value of 100%. Patients get 6 points if they are 50 years of age or younger, 3 points if they're admitted for trauma, 1 point if their SOFA score is 4 or less upon ICU admission. An ARC score greater than 6 is associated with augmented renal clearance. One criticism of this scoring system is that it is cumbersome and not realistic because it requires the separate calculation of the SOFA score. An alternative scoring system, the ARTIC score, has almost as good results as the ARC score for predicting augmented renal clearance. The ARTIC scoring system is 4 points if the patient is younger than 56, 3 points if they're 56 to 75 years of age, 3 points if their serum creatinine is less than 0.7, and 2 points if they are male. Again, a positive score is 6 or higher. The negative predictive value of this test is 84%, and the positive predictive value is 68%. Both values are slightly less than the ARC score, but the calculation is much easier to complete. Members of my Hospital Pharmacy Academy have access to my new in-depth training on a pharmacist's approach to augmented renal clearance, as well as over 75 other in-depth practical trainings. This is in addition to full-text journal access, weekly literature digest to stay up to date with the medical literature, resources to make precepting easier, and much more. To sign up for immediate access, go to pharmacyjoe.com/academy. Thank you so much for listening. I'll see you in the next episode of the Elective Rotation.